Welcome to Wellness by Mommy. I hope you are safe and sound. In today's video, let's talk about risk factors for baby ear infections. At the end of this video you will understand how to treat ear infections at home, prevention and what to do if your baby have repeated ear infections. Watch my previous video on detailed information about baby ear infections, causes, symptoms and what happens at the doctor's office. The majority of children will get at least 1 or 2 ear infections in their first few years of life, so if this is happening to your baby, don't fret. But some babies may be more at risk for ear infections than others. Here are some risk factors that may increase your baby's susceptibility. If you have a family history of ear infections, your baby may be more likely to get them. Your baby is more likely to get an ear infection with the more colds and other viruses they pick up. Babies who have allergies are more likely to have ear infections because of the swelling and inflammation that allergies can cause. Babies with chronic illnesses are more likely to experience ear infections, especially if they have respiratory diseases such as cystic fibrosis and asthma. Being exposed to secondhand smoke can increase your baby's risk for ear infections. Babies who are bottle-fed are more likely to experience ear infections than breastfed babies. However, you can minimize the risk by bottle feeding your baby in an upright position, so that milk doesn't pool in their ear passages. Making sure your baby doesn't fall asleep while drinking a bottle can also decrease their likelihood of getting an ear infection. How to treat ear infections at home. Whether your baby is prescribed antibiotics or not, you will want to decrease your baby's pain and discomfort as they recover from an ear infection. Here's what you can do. Depending on your baby's age, you can give your baby pain-relieving medications such as acetaminophen or ibuprofen. Again, check with your doctor on what pain reliever is appropriate for your baby as well as dosage. Never give your baby aspirin, as this can cause a dangerous condition called Ray's syndrome. In addition, your doctor may recommend ear drops that reduce pain as well as simple at-home remedies like warm washcloths or heating pads for comfort. Can baby ear infections be prevented? Ear infections are very common. In most cases, there's not much parents can do to prevent them, and you shouldn't feel guilty if it happens to your baby. However, there are a few things you can do to reduce the likelihood that your baby will come down with an ear infection. Reducing your baby's exposure to secondhand smoke. Practicing good hygiene such as frequent hand washing to reduce the chances of your baby picking up a viral infection that may lead to an ear infection. Keeping up with your baby's vaccines and getting an annual flu shot. What to do if your baby has repeated ear infections. It can be very stressful if your baby has repeated ear infections, though this is also common in childhood. If the infections are very frequent or if they are causing temporary hearing loss for your baby, your doctor may want to intervene. The most common intervention for repeated ear infection are small tubes, tympanostomy tubes, that are placed in your baby's eardrum. These tubes are left in for 6 to 9 months and decrease the fluid buildup as well as improve airflow quality. Frequent check-ins with your doctor are necessary if your baby has ear tubes. If tubes don't help solve the problem, sometimes doctors will suggest surgically removing your baby's adenoids, especially if they are swollen, enlarged, and seem to be contributing to your baby's ear infections. Again, if you suspect that your baby may be suffering from an ear infection, it's always better to be safe than sorry. Call your pediatrician for advice or for an appointment. Chances are, your sweet baby will be feeling better in no time. I hope you find this helpful. Please subscribe for more interesting, evidence-based, educative and informative videos. Like and share this video. Turn on your notification icon so you can be notified when next I drop a new video. I desire for you good health and long life. See you in my next video. Till then, stay safe and remain healthy. Peace.